Hey guys, in this video I'm going to go into detail about the pathophysiology of congestive heart failure. Specifically, I'm going to cover systolic heart failure, or the inability of the heart to pump blood by contracting or squeezing the blood out to the rest of the body. And I'm also going to go into diastolic heart failure, which is the inability of the heart to relax enough to fill up with blood. Okay, here we go. Okay, so in my previous video, I mentioned that the heart can be split into two pumps. On one side, on the right side, it pumps blood out to the lungs, where it gets oxygenated, and on the left side, it pumps blood out to the rest of the body. So this is the left side right here, and pumps blood to the rest of the body. In this part of the video, I'm going to try and focus only on the left side of the heart, and we're going to simplify this pump into one single chamber. So, simplifying the left ventricle, we have this. Let's get this out of the way here. This is going to be our left ventricle, and the left ventricle has valves. So, each of these is going to be a valve. This is going to be one valve over here. We're going to have another valve over here. And each of these valves is a one-way valve. So when blood is pumped from the previous chamber, the left atrium, so blood comes flowing in, each of these valves will, under pressure, let the blood flow in and fill up this ventricle. So this is the blood that's filling up in the ventricle. And eventually the chamber will contract, so it will get smaller to squeeze the blood out to the rest of the body. This chamber will get smaller, and the blood that's already inside here will be pushed on to go out to the rest of the body and provide the nutrients and especially oxygen to feed the rest of the body. So one way in which this can all go wrong is, as we mentioned before, called systolic dysfunction. And in systolic dysfunction, let's write it out here, systolic dysfunction. And in systolic dysfunction, the heart is unable to contract, to squeeze with enough force to push the blood that's in it out into the rest of the body. So blood will be flowing in as normal and put enough pressure to open the doors and flow in, fill up the heart a little bit. But when the next contraction of the heart comes along, it won't be a very strong one, and it'll be just a little bit, a very weak contraction that will lead to very little of the blood actually leaving the heart. A few possible causes for a weak heart are myocardial infarction, which is when you have a heart attack. It's a fancy way of saying a heart attack. So it's when the heart doesn't get enough blood itself, and therefore it can't function properly and it gets damaged. So myocardial infarction is one of the major ways. But also damage from congenital disease. So a heart that's just not properly formed when the baby is born, when the patient is born, can lead to a very weak heart, and therefore it would be unable to properly contract and squeeze the blood that's in it out to the rest of the body. In diastolic dysfunction, we have a similar situation where not enough blood can leave the heart and supply the body. Diastolic dysfunction. And what happens here is blood comes along normally, fills up the heart, but there's already a lot of space in the heart that's been taken up. So, for instance, in the case of myocardial fibrosis, you've got deposition of fibers of scar tissue, of all kinds of tissue that fills up the ventricle of the heart and prevents and makes the filling chamber, the place that the blood's supposed to actually go, very small. So when the blood comes flowing in, only a little bit of it can actually fill up in here, and that little bit is all that ends up getting pumped out. So we have a very small amount that ends up getting pumped out of that chamber. And as I mentioned, some of the causes include myocardial fibrosis. So that's just a disease in which some scar tissue is deposited in the wall of the ventricle of the heart. You can also have amyloid deposits. It's another form of tissue that ends up being deposited in the walls of the heart. You can have pericarditis. So pericarditis. Peri means, actually, let's move this up here. Peri means around, so around, and card is from the Greek for heart, cardia, and then we have itis, which is for inflammation. So around the heart, we have inflammation. We have inflammation that ends up putting pressure and shrinking the chamber of the heart, and therefore blood, the same small amount of blood ends up being pumped out to the rest of the body. Finally, we have what's called cardiac hypertrophy. Cardiac hypertrophy, and that's just a way of saying that the heart has extra muscle being built up. So hypertrophy. We have hyper, more, and trophy, which is growth. So more growth of the muscle of the heart. And that happens when the heart is under a lot of stress from things like high blood pressure or damage to the heart from, again, the myocardial fibrosis or the diseases. So as you can begin to tell, this becomes a very vicious cycle in which blood ends up coming in and trying to fill the heart, but for whatever reason, there's something preventing it from filling or from leaving the heart at an adequate rate, and you end up with a buildup or congestion, which is why you call it congestive heart failure, congestion of blood in many vessels, and that congestion, that buildup of blood can actually build back up all the way to the lungs. So that's another reason why people with congestive heart failure have difficulty breathing, as I mentioned in my previous video. Well, that's all I can cover in this video. Look out for my following videos for more information about congestive heart failure. Well, that's all I can cover in this video. Please look into my later videos for a little bit more information. Thanks for watching.